sports arena right in the heart of Los Angeles. We are certainly looking forward to this event and the several thousand people that will be served during this week with eye care, dental care, and health care, in which many people have no other options other than being here today. And many people, when we walked in the door today, wanted to know if this is going to happen over and over again, because they see the need and they understand what it means not to have health care. For all of us in general that have health care, what happens is that people without health care use our emergency rooms as their primary doctor. And so these are things that we have found a way today to give people some hope, to give them some understanding that there are people who care and that there are services that they can take advantage of. And so I'm pleased to be here representing the Los Angeles City Council. Certainly am pleased that the 8th District is the headquarters for this. And I just have one favor to those the listening audience and viewing audience, is that if you can find it within yourself to come down and volunteer during this week, it would be a very important commitment of your time to come and assist with this. We have the first-class medical assistants, first-class equipment and technology, first-class medical personnel. The issue today is that we have enough volunteers to help the several thousand people get through the system and get the care they need. Thank you very much.
One of the great privileges of being part of this event has been the opportunity to work with some really exceptional people. Nowhere is that more true than in the case of LA Care and Howard County. These folks have just been outstanding, and they've helped us in so many different ways. We're very grateful to them. I'm personally very grateful to our next guest, Howard County of LA Care.
Good morning, everybody. What are you doing for others? Martin Luther King Jr. asked that question of us many times in many speeches. Last August, LA Care was RAM's first sponsor here in Los Angeles and made it possible for over 7,000 people in Los Angeles to get free health care between now and then. So these are working people here in Los Angeles who have no coverage. I'm really pleased that since our last RAM event, we've had some major progress in this country. The legislation that President Obama signed is historic in terms of national health care reform. It will change the face of health care forever, not just in Los Angeles, but throughout the country. The bill addresses many of the long ignored problems in this country, but that expansion won't go into effect until 2014, 4 more years. And so between now and then, there are still going to be millions of people here in Los Angeles and throughout California that will have no coverage, that will need events like the RAM event. We've got a $20 billion state deficit. We've got record unemployment in Los Angeles County at 12.5%. In this kind of environment, people forego preventive care. They result in more serious injuries. They end up in emergency rooms seeking care that is long overdue. Thomas Fuller, the historian, theologian, said, "It's always darkest before the dawn." What I see here today gives me a lot of hope for where we're going. I see doctors, I see nurses, I see dentists, I see optometrists and their assistants giving of their time for members of their community. Through the darkness, I see our community coming together to serve, extraordinary people volunteering here. This is an inspiring and both a shameful thing that we have to do it. But it's wonderful to see everybody coming out and giving of their time, of their money to support this effort. I congratulate everybody who's been involved in it.
We live in San Fernando Valley.
Okay.
In the area of Van Nuys. Basically, I got an email about this. Then I think they doing it last year.
Yes.
And I saw the newspaper, the La Opinión newspaper, with the information about this, and I try to take the chance to don't miss the opportunity to be checked.
Yeah.
Because basically right now it's really expensive, all health plans and services. It's very expensive. They charge like $600 for me and my family every 15 days.
Wow.
So I can afford it because I got for 2 weeks I got paid for almost $900. So it's not possible to get insurance from my
Right.
work. Oh well, basically it was very easy, especially that's free. So I had to wait the whole day, no problem, because there's no opportunity such as this one to get a free
Free healthcare.
checking. She's ¿cuántos años tiene? She's 3 years old. We help you with the money, because we got only money to cover the necessary things like paying rent, car insurance, gas, and it's hard to don't have the necessary money to go and see doctor at least once a year. She was she's been covered with the government medical plans, and for them I'm really happy. But what about when they are not gonna cover that? We're going to start having problems. She was in the doctor probably. Oh, basically we were in the emergency because she had a problem last month. She got the flu.
My name is Helen. I have a adopted daughter. Her name is Jasmine, and I don't have medical coverage. I do have a job, but I didn't have the medical coverage. So I brought Jasmine down to get dental, vision, and some medical assistance, like a physical for school, and also myself. I'll get my eyes checked, get some little dental work, and get to see a doctor.
Yeah.
So far, so good. Jasmine, about a year ago, because she had to have a lot of stuff done for last year for
Okay.
school. So it's been a year, myself almost 2 years. Just keep trying to find other free clinics that will give the services out. It's very hard because most of them, even though they say they're free, you still have to pay a certain amount, you know, $45 for this or $50 for that. So it's always a charge for something. It's not actually free. I am working.
That's
Yeah,
good.
Yeah. Matter of fact, hopefully within the next 3 to 6 months, I'll be able to afford my own health insurance, which will be good.
Yeah, that will be good.
Will be good, but we're talking 3 to 6 months from now. So
Right.
right now, I needed some help.
Right. Well, thanks for coming out today, and thanks for talking to
I
us.
really appreciate this. This is great, and if anybody, you know, this is where it's at. I mean, there's a lot of people out here that, you know, really have jobs and can't afford it. It's not just a whole lot of low income, you know, people that are on the system. There's a lot of working people out here that can't afford insurance.
Yeah. Well, thank you.